Hi, my name is Owen Atkinson of Dairy Veterinary Consultancy, and this is the third presentation in a series of 4 looking at milk PAG pregnancy testing. And this presentation is really to get a little bit more detail around the accuracy of the milk PAG test. So helping people who are wanting some technical information about things like the lag and what are potential errors which we should be aware of when using the test. So no test is perfect, and nor is the PAG test for pregnancy. However, since it became commercially available, there has been an incredible amount of work undertaken by independent researchers. And these results can give us remarkable confidence, actually, in its accuracy in practice. Now, overall, the accuracy of detecting pregnant and non-pregnant cows at between 32 and 52 days post-insemination has been described as 99%. That is, if you looked at 100 cows between day 33 and 52 after service, this milk test, the PAG test, would accurately predict 99 of those 100, whether they were pregnant or non-pregnant. Now, one thing to be aware of, perhaps, is this idea of a lag period at the end of a previous pregnancy when PAG levels may still be detectable. So this graph shows the results of a study showing how long it takes for PAG to fall below the positive level after a previous normal pregnancy and calving. So after calving, PAG levels, they start high, but they fall quite sharply initially, and then there is a slight leveling off. That's to do with the half-life of PAG, just taking a little while to get down to the 0 level. On average, actually, levels are below 0.25, which is the positive cutoff, by 30 days after calving. However, as with all biological tests, there is some variability around the mean. So in order to be confident that PAG levels are not from a previous pregnancy, the standard advice with this test is not to use it for pregnancy diagnosis within 60 days of the previous calving. But as you know, there would be few circumstances when this would be likely in any case. Now, in terms of pregnancy losses that happen through gestation, there is still this lag period when PAG may be detected despite the fetus no longer being viable. And for late term abortions, so that means 12 weeks or more, it is recommended to wait 40 to 60 days before using the PAG pregnancy test for the next pregnancy. Again, that shouldn't really cause a problem in practice. For early fetal death, however, because the PAG levels are lower to start with, the lag period is shorter, but there is still a lag period. So if we looked at what happens here, if you had a theoretical embryo loss at 35 days, we're starting off with quite a high level because there is a high PAG level very quickly after 24, 25 days. It goes high quickly. So at day 35, there are very strong PAG levels normally. As soon as the embryo is lost, there is no more PAG being produced because remember, PAG is only produced from a healthy and viable placenta. But because it does have a half-life of a day or so, it takes a little while for those PAG levels in the serum, which are reflected in the milk, to go to the 0 level. So although the PAG begins to fall immediately and rapidly, it is likely to take 6 to 10 days to recover the negative result. You'll notice that it spends most of that period actually in the recheck zone. So in this period here, it might be in the recheck zone for 4 or 5 of those 6 to 10 days. And in fact, if after 28 days post-service, a cow does return a result in the recheck zone, a failed early pregnancy is a very likely reason for this low but detectable PAG level. Now, when it comes to overall accuracy of the test, it has been compared to transrectal ultrasound and per rectum palpation. But one difficulty with comparing a new test with an existing test is that the existing test itself is not necessarily the gold standard. And this is certainly true when comparing the milk PAG test with traditional rectal palpation or ultrasonography, which themselves are imperfect tests, especially when conducted in early pregnancy. So we're talking between 28 and 35 days. There is, however, a recently published Canadian paper which uses sophisticated Bayesian statistical modelling in order to estimate the diagnostic accuracy of both the milk PAG test and transrectal ultrasonography by an experienced operator for determining the pregnancy status of individual dairy cows at between day 28 and day 45 after service. And it found again that the two tests overall have a 99% accuracy. However, there is a difference in the negative predictive value. So this is how good the test is at saying, when it says the cow is negative, actually how reliable is that result? You know, is a negative a true negative? And the PAG milk test performs slightly better than transrectal ultrasound in this respect. And that kind of makes sense, because if you think about transrectal ultrasound, even with a skilled operator, when we're looking at those early pregnancies, it's actually quite possible to miss the early pregnancy. So you could be scanning the uterus, but you just don't see it. That's easy to do, even with a skilled operator. And therefore, the operator, the vet, may say the cow is negative, but in actual fact, she's not negative. There is a pregnancy there. It was just missed. I'm not saying that happens very often. Don't forget, the accuracy overall is 99%, but it is more likely to happen with the ultrasound scanning than with the milk PAG test. However, on the converse, if we look at the positive predictive value, i.e., when the result comes back as a positive, we're saying the animal is pregnant, how sure can we be that she really is pregnant? Then this is where the PAG milk test performs slightly lower than transrectal ultrasound. And the reason for this is likely to be because of lag, which I've explained earlier. So it will be because there's detectable PAG levels from a pregnancy that is no longer viable. Don't get too hung up on all of this, because overall, both of them have 99% accuracy. Now, in presentation number 2 of this series of 4, we did look at a little bit of a comparison between ultrasound, transrectal ultrasound, and the PAG test. And just reiterating again, both are approximately 99% accurate at 32 days, slightly more false negatives with ultrasound, slightly more false positives with the PAG milk test. But it really shouldn't have much bearing on your choice for this early pregnancy diagnosis. But there are other pros and cons that we might want to look at. So for example, transrectal ultrasound, it is possible to detect twins. With a skilled operator, it may be used for fetal sexing. If you wish to do that, it has to be done at a very specific time, around 55 days into pregnancy. And of course, because you can visualize and measure the fetus, it should be possible to age the pregnancy, certainly in early pregnancy. And that can be important where there's unknown service dates. Some of the disadvantage, I guess, of transrectal ultrasound is it requires a skilled operator. It does require segregation of the cows. Compared to milk sampling, it's an invasive procedure. And actually, one not to underestimate is the fact that it causes repetitive strain injury for the operator, the scanner people themselves, or the vets themselves. And when I interviewed a series of experienced dairy vets recently, looking at their attitude towards PAG pregnancy testing and an ultrasound, that was their biggest concern about ultrasound, was the fact that a lot of the vets, or a high proportion of the vets, I think it was 1/4 of the vets I interviewed, flagged up that they themselves were already starting to suffer the repetitive strain injury from scanning. So it's something not to be underestimated. Now, PAG testing, meanwhile, so it won't diagnose twins or help you age the pregnancy. It just gives a yes or no result. But on the plus side, it's a non-invasive procedure because we can do it just with a milk sample. There is no need to segregate the cow, which is advantageous for the cow. It can be very simple and convenient as a means of pregnancy diagnosis. It can also help us to use skilled veterinary time in a more efficient way, and we'll look at that in the 4th presentation of this series. It reduces the unnecessary scanning of pregnant cows, basically. And depending on how frequently you wish to take the milk sample, it can actually assist you with more regular and therefore earlier pregnancy testing of more cows. And again, we'll look at that in the fourth of these presentations. One thing which is sometimes brought up is the fact that there is a dip in the PAG levels at around about day 60. Now, because the cutoff is 0.25, that shouldn't really give you much reason for concern. Because as you can see, the vast majority of cows, even at day 60, will be above that 0.25 zone. Remember that if you get cows in the recheck zone between 0.1 and 0.25, one reason for that is because you're having a falling PAG level after a pregnancy has failed for whatever reason. The other reason is potentially because we have got some low PAG levels in some of those cows at around about the day 60 mark. But nevertheless, you shouldn't expect more than 2 to 3% of cows in the recheck zone if you're taking your milk samples from between day 28 and day 75. So we're not talking a huge number of cows. The majority of them will probably be because they're having a failed pregnancy. The data is important, though, to look at, because if you are a farm or you're working with a farm that has 6% or more of cows in the recheck zone, then it will be important to investigate late embryo death, because that could be a reason for that. And this kind of information is available through using the PAG test, which wouldn't be available through using transrectal ultrasound as your primary pregnancy testing method. Now, whichever method you use when you're doing early pregnancy detecting, it is valuable to use a confirmatory test, and the PAG milk test is the most convenient way to do that. So we're looking at taking a milk sample from cows that are more than 11 weeks served to check their PAG levels are still high, and looking for those pregnancy losses that may occur from day 30 to day 77. So in summary then, PAG testing, it is a reliable alternative to transrectal ultrasound for early pregnancy diagnosis. There are some pros and some cons to each method. Again, we'll just look at that a little bit more in the practicalities, which is the fourth of these presentations, which is coming up next. Both have very similar accuracy, although the PAG test has a greater negative predictive value. In other words, if the cow is diagnosed not in calf at day 28 to day 45, we could be more certain that she is actually not in calf. And in any case, whichever early method you're using, please do make use of a confirmatory milk PAG testing after day 77. I hope you found that useful. The final presentation in this series of 4 is looking at the practicalities. What is the best way to use milk PAG testing on your farm, depending on what your farm type is and what your circumstances are. So that's coming up next. Thank you very much.